Hello, everyone. I'm sorry there's not enough seats for everyone, but it's so nice to see such a brilliant turnout to talk about sleep. So, to introduce myself, my name is Dr. Caitlin Chasser. I am a GP by training, have been dedicated to sleep and fixing sleep, and trained in cognitive behavioral therapy, circadian rhythms, and all about improving sleep in different situations. I'm part of the Sleep Project. We're an organization of clinicians who work with individuals, with businesses, and in elite sport, improving lives through the power of better sleep. I'm going to start off with my own story of sleep because I think that's important. So about 15 years ago, I was trying for a baby with my husband. We decided now was the moment, and it was not going as planned. I'd had various miscarriages and investigations and IDA, and 4 of these things were stressful. And the result, I wasn't sleepy. I was awake at 2, 3 in the morning, hearing noises outside, my brain absolutely full of thoughts that would switch off, and then having to get up the next day and sometimes having 100 contacts with patients. And though not every decision was life or death, they were important decisions, and I really wanted to be at my best. And so I look back on my own training. I've been a doctor for more than a decade at that point, and thought I should be able to fix my sleep. But I thought that if I come to see myself as a doctor, what would happen? Maybe I would prescribe sleepy tablets or antidepressants. But I didn't actually know how to fix my sleep. And that's not unusual. I now know that most doctors don't get trained on sleep. Across the whole of Europe, the average is 30 to 60 minutes training on sleep. And so when you go see your GP, the majority of the time, you get tablets because they get trained on sleepy tablets, or you get told sleep hygiene. And for anyone who's had a significant sleep problem, being told to not use their phone before bedtime or cutting down on caffeine just doesn't work. And so I went on this journey of discovery, looking into psychology, psychiatry, Eastern practices, cognitive behavioral therapy, insomnia, circadian rhythm therapy, and the results were incredible. I fixed my own sleep. I went on to be clinical director for the North Cotswolds, thriving in my career, and I was able to start the family that I had dreamed of. And it was so life-changing for me that when the COVID epidemic happened, and I saw my patients, my colleagues, my friends losing their ability to see as well, we came together as a group of clinicians to work with people to improve their lives through the power of better sleep. Because what I knew was that people in organizations are not sleeping. This data is from a Nuffield Trust review, and 74% of working adults get insufficient or poor quality sleep. Over on our stand at 127, we've done a little survey, and you can see that everyone is getting less sleep than they need. And that has a big impact. And the causes for that poor sleep are varied. It could be stress. It could be mental health conditions. It could be having a new baby in the family. It could be menopause impacting on their sleep. But it impacts their well-being, how they feel and function at work. Now, I had a conversation with a CEO about helping their organization to sleep better. And they said, but sleep is automatic. It just happens. And in some ways, they're right. It's controlled by our autonomic nervous system. It's beyond our control in some ways. But for many people, it doesn't feel very automatic. And it is more important than almost any other function. In fact, we die quicker without sleep than we do without food. And I want to talk about why sleep is going wrong. I want you to imagine that we're going back in time. You're a hunter-gatherer, and you wandered off, and you're in the middle of nowhere, away from the community, and it starts to become dark. You need to sleep out in the open. how do you think you're going to sleep? You're probably not going to sleep deeply. You're probably going to sleep in fits and starts and be hyper aware of the surroundings, because our nervous system is designed that if we do not feel safe, we do not sleep, because sleep is a time of vulnerability. When we're in deep sleep, our muscles are relaxed, we're not aware of the world around us. We're in dream sleep, our muscles are paralyzed, we can't run away quickly. So sleep is a vulnerable time. And so if we don't feel safe, we don't sleep. But our nervous system, which has been designed over millions of years, the way that we're living our lives in the last 100 years has changed significantly. The environment is different. Our nervous systems are becoming overstimulated. And as a consequence, we can't tell the difference between a stressful email from our boss at 10 o'clock at night and a bear sitting in the room with us. And we just can't switch off and sleep as we're meant to. And what's the impact of that? And I want to talk about sleep cycles. So every night we go through 90-minute sleep cycles. And in between each sleep cycle, we wake up, we check the environment around us, make sure that we're safe before we go back to sleep. And that sleep is divided into two different types: dream sleep and non-dream sleep. And each of those is really important for our well-being, for cleansing our brains, for making us feel refreshed the next day. The dream sleep is really important for emotional processing, for taking everything that we've experienced during the day, and taking the trauma out of it, and making sure that we're resilient and able to function the next day. The non-dream sleep is about physical healing, about repair, about strengthening our immune system and preventing chronic disease. So when those two things go wrong, it has a big impact on how we feel and function. So if I ask people at HR or occupational health, are they seeing people with poor sleep? Often they'll say, no, I'm not. But you might be seeing other sides: reduced productivity, mental health problems, increased staff turnover, absences from work, and accidents and injuries, because those are the ways that poor sleep present in the workplace. And people don't put bad sleep on their sick note. The RAND study looked at sleepers across all of Europe and looked at the reasons why people who have insufficient sleep didn't come to work versus people who had good sleep. And the interesting thing was they put the same reasons on their sick notes: back pain, chronic pain, stress, flu, depression, but they were off work significantly more than those people who were good sleepers and got sufficient sleep. So poor sleep presents in the same way as other health conditions, which may be why people don't come to you saying, I'm not sleeping well. It just might not turn up at work, or turn up and not be fully engaged with what's going on around it. So poor sleep, it shows up in these ways: accidents, injuries, infections, poor decision making, impaired leadership. I'm going to talk about the cost of poor sleep. And there's the cost to the individual, but also the cost to the organization. We know that if you sleep well, you are more productive. And this data is from the RAND study, which looked at countries across Europe. We are 40% more productive if we're sleeping well. We have less absences. This is the amount of days absence across a year, comparing someone who's a normal sleeper versus a poor sleeper. And it's a significant difference, and that has a cost to the bottom line. It has a cost on mental health, in particular burnout, depression, postnatal depression. So our mums coming back from work, if they're not sleeping, are much more likely to develop postnatal depression and anxiety. But also accidents and injuries. We know that you're more likely to have a significant accident or injury at work, and that the ones that cause permanent work disability are 75% more likely if you are having core sleep. And RTAs are road traffic accidents, 2 to 3 times more common. And the facial ones, 30% for all facial road traffic accidents can relate to insufficient sleep. And the reason I'm here talking about this is because it's the elephant in the room. 80% of people with sleep problems are not getting help. They're undiagnosed. They're living with the consequences of poor sleep. On average, it takes 6 years for someone even to talk to someone about their poor sleep. So there's a significant amount of time these consequences are evident in the workplace. And when we talk about a workplace is all about the people. And if those people are not sleeping well, then there's consequences to that business. And for that reason, sleep is the business. It's not a personal health problem. It is about the health of organizations, how it performs. And there's a return on investment. Not only are people feeling better, but they will perform and function better. And if you take away one thing from this talk, I want it to be this. Bad sleep can be fixed. I cannot tell you how many patients who come to me who've had decades, even lifelong histories of poor sleep. And within a short amount of time, their sleep is improved and they are feeling and functioning better. They feel like they have their life back. The most common feedback we get is that the services are life-changing because we all know intrinsically that life is easier after a good night's sleep. And that we know that if people go and see their doctor, the chances are they're not going to get the treatment they need. They're either going to end up on sleeping tablets. They might be given just sleep hygiene, which might not work. For the majority of people, it doesn't work. And when we intervene and do proper sleep therapy, it really changes how you feel functions. We've got Lee, who's come onto our team. He's here in the middle. He joined us because we fixed his sleep and he was so inspired by that whole process of wanting to help other people that he joined our organization, which is fantastic. So do have a chat with him afterwards. And so this is us. We're the Sleep Project. We are a group of clinicians who come together to improve lives through the power of sleep. We work through all life stages, from babies all the way through adults, and for all those sleep bumps in the road, whether that's having a new baby, going through menopause, returning to work after a stressful time. If you're interested in learning more, come and talk to us. We're on stand 127. Scan the code and you can download our starter pack, which has lots of information about sleep, about starting conversations about sleep. And you can be entered into our prize draw for a Sleep Ambassador trainee, which is worth £450. In addition, we got a prize draw. We've got a gift box full of everything that you need for a good night's sleep. If you just draw a business card or just write your name and email into this little pot here, we'll enter you in to win that prize. And if you don't have a leaflet, there's some here. Or if anyone wants to talk to me about sleep problems, whether personal or for their organization, catch me after the talk or and send one to Sarah. And I'm really happy to take questions as long as nobody kicks me off at start.